We provide a service for adults suffering with mental health diagnoses, and the aim of our service really is to promote independence. In January 2015 we redesigned the service, and I think we had a very much of a patient focus rather than a person focused. When we discharged people from a 24-hour hospital setting where they'd been for roughly a few years, they were going straight into the community with very little support. We came up with the idea to close 2 of those units, which was reducing the beds by 15, which is quite a big step almost to take beds out of the system. But we supported that with setting up a new recovery centre, and that was done in partnership with the third sector. And I think on the national picture it's really important for us to be starting to think about partnerships, how we work with organisations more locally and the pathways we create for service users. And I think those organisations just challenge our practice and help us think differently, help us think about how we get people out into the community, because ultimately we don't want people in hospital. One of the most important things we've implemented here is a cultural shift, and that is that cultural shift from being very inpatient, patient focused to an outward looking service that's about the person. And the impact of that cultural shift is massive. I think the service user experience is better. They're reporting and telling us that they feel more supported, they feel more confident, that they're able to access things in the community. Having a team that can support that and be around for people when they really need it, which is that transition from hospital back into the community, has been a huge success.
We have around 3,000 staff, and they're based across services and sites both in Leeds and York. Obviously there is a national shortage of nurses, that's no secret to anybody.
We wanted to look at a way that we could attract good candidates to come and work for LYPFT.
What we needed to do is, I suppose, come up with something that was a bit more innovative and a slightly different approach to actually break that cycle of constant recruitment. We put together a recruitment project.
So we used different methods this time, different ways of advertising, exciting ways of advertising. We've been out on the wards, we've done massive assessment centres where we've had 180 people coming in that day for a job. Can you imagine that? 180 people in one day.
We also brought in other elements around testing.
We've got some positive testimonials. They've then been incorporated into our adverts, and then they've gone out on social media.
It was very important to us that we had clinical components and clinical elements to the recruitment and selection process.
I've used my expertise as a nurse to help within the project. I can give a perspective of what it's like to work on the front line.
One other thing that's very important to say is that we do place a high regard in terms of service user involvement in any sort of selection event that we do.
It's been a positive experience, and we've been able to recruit approximately 180 staff, including nurses and support workers. Bringing that amount of people into the organisation is phenomenal. When you look at it like that, I think it's been really successful.
As part of a nurse, your vocation is to care for people and to ensure that they are well. The thing that our clients may not understand is how to articulate that they are unwell, and lots of times they go with illnesses that they've had for a long time, but because they don't understand them and they can't tell people exactly what's wrong, they don't say anything. What we started off doing was helping the GPs to understand their register, understand the people who have a learning disability within their practice. We worked with our communications team in order to be able to facilitate easy read information. So the health check is usually split into 2 parts. The first part would be with a healthcare assistant or one of the practice nurses, and the practice nurse or the healthcare would undertake things like the blood pressure, the height and the weight, and then the patient usually goes back to the GP where they may get their results, and the GP can consult with them and advise them if there's anything that needs to come from those results that have come back. Over the 2 years that we've worked, we've actually encouraged GPs to see over 500 patients. We've also designed a website, so all of the documents that we use that are easy read are accessible to clients, they're accessible to parents, to support workers and to professionals alike, and they're all free of charge, so there's no implication for the GP in terms of cost. And that website receives roughly now about 200 visits a day, which is quite a lot of people being able to access information to help things go a little smoother at the GP.